Drug actions within the body. When we swallow a tablet, it disintegrates and then it dissolves. Pharmacokinetics and membrane transport into cells can be passive, active, or through a process called pinocytosis. Pharmacokinetics, absorption is affected by bioavailability, first pass effect, water solubility, and lipid solubility. Bioavailability is the proportion of a drug entering the body which has an active effect because of its entry into the blood. IV drugs have 100% bioavailability, whereas oral drugs, the bioavailability is greatly reduced because of something called the first pass effect. First, it passes through the hepatic portal system and the liver, which is a spot where the medication can be degraded actually before it's sent out into the system. Depending on whether it's water or lipid soluble, that can affect its bioavailability also. Distribution occurs through protein binding, blood flow, and body tissue affinity. Barriers to distribution include the blood-brain barrier and the placenta. Pharmacokinetics, or getting rid of chemicals, have to do with half-life and excretion. How well we excrete things and how well we break things down affects how we get rid of a product. That half-life, again, we talked about this before, but the amount of time it takes for half of that bioavailable drug to be gone. And excretion has to do with a lot of times urinating a lot of these off. There are other ways of excretion, but that's one of the more common ways. Pharmacodynamics deals with the way the drug affects the body. We can look at primary and secondary pharmacodynamics. With pharmacodynamics, some books will look at the onset, peak, duration, dose response, and maximal efficacy. Pharmacodynamics will look at whether it's an agonist or an antagonist, and particularly whether they're weak or strong agonists. Pharmacodynamics can also look at the non-specific drug effect versus the specific drug effect. For instance, we looked at beta-1 selective beta blockers versus ones that weren't so selective that affected both the beta-1s and the beta-2s and resulted in some asthma-type side effects. Pharmacodynamics, drug action categories. So we look at the categories of drug action. We look at stimulation or depression, replacement, inhibition or killing of organisms, and irritation. We looked at the therapeutic index quite a while ago, looking at the index in between where the drug once at first becomes therapeutic and we get the response that we want, and then at the top of that therapeutic index is where it's still therapeutic, but that anything above that is oftentimes toxic. We can move into pharmacodynamics by looking at the placebo, and a placebo is something that can be given that is a sugar pill basically, and we can get effects due to what the person thought they were going to be affected by that drug. So it's a psychological phenomena that has some physiological basis too. There are some physiological changes within the body that occur when the body truly believes that something is going to happen. Tachyphylaxis. Tachyphylaxis is a medical term describing an acute, sudden decrease in response to a drug after its administration. for example, a rapid short-term onset of drug tolerance, it can occur after an initial dose or after a series of small doses. Increasing the dose of the drug may be able to restore the original response. Side effects